like our technology has surpassed our willingness or ability to pay for it, especially when you consider that we're paying for how many other millions of people that aren't citizens, and it's coming. We're paying for it. How do we change that?
The first thing we do is we secure the borders. That's the way it is. So, you know, and that's one of the things that kind of keeps getting pushed away, but we can't stop that problem until the borders are secure. That's plain and simple.
Bobby, repeat the questions. A lot of us back here.
Oh, I'm sorry.
Yeah,
repeat the
a
question.
little louder.
Basically, he was talking about the illegals that are draining our system, and my response was that what we need to do is we need to secure the borders, because if we don't secure the borders, that problem will never go away.
But we've also got great technology. Every day there's always breakthroughs, but that doesn't come cheap. That's expensive. And we're all living, what, 10, 15, 20 years longer than we did 30 years ago. And we have to pay for that, and we're all willing to pay for that, but we don't want to pay more than our fair share. And, you know, is there going to come a time where, you know, if you're not willing to work, and I mean willing, and if you're illegal, maybe you don't get medical care.
Yeah, you know, I don't know if that's
That's
ever
dangerous. I mean, that's
right.
a dangerous political point for you, but it gets really old.
Yeah, and I understand. Yeah.
I have a question. I'm in health and in healthcare, and in Florida, I took care of many Canadians who came to the United States to have good care. They paid for their insurance in the States. And so what's going to happen to those people as far as how will they get their care instead of waiting 4 months to get an MRI and being on hold up there and not being able to come to the States? And part two, I heard this woman ask about her mother who had at 100 needed a pacemaker, which my mother at 90 did, and she did have her pacemaker and her stents, and she's, you know, doing well. This lady was 105, but yet the president said, take a pain pill. Well, that's not how you treat those things. So is that in there? Are you seeing those two? They're hidden in some way, and that the good care will not be there.
Yeah, you know, and that's the one thing is, and this is back to that doctor shortage thing. You know, it takes about 10 years for a doctor to start to finish, and you know, we really need to address that because. And then with what's going on in this current bill here, and I know there's some changes that are going on with the Senate one, but you know, if they bring these guys all out and they have like a level dollar amount that they can make, you know, where's the incentive to go and become, you know, a specialist on this end or this end? You know, it's really tough, and a lot of the guys that I know that are close to retiring, a lot of them are pretty well financially secure. And they've told me, if that goes through, I'm out of here. I'm done. I don't need to work anymore. So that just is going to take and really add to that problem of the doctor shortage. You know, that's one of the things that I've mentioned. You know, we have people, our healthcare people are the greatest in the world. I mean, we have people from all over the world that come to the United States to get care. So where will they go? I don't know. That's a good question. So, yes.
I'd like to make a point about the healthcare and what resources are available. Somebody mentioned back surgery. I just had back surgery, and we have a small farm. And there are resources available to you to help. Springfield's got a big layout on disabled farming. The equipment you can use. Take some of the money that we're going to spread around to people that are going to sit on the butt the rest of their life because they have back surgery, and we train them to do something else. If you're going to sit down, you can sit in front of the keyboard. You can sit in front of the workbench. It's not a matter of sitting back until the mailman comes and waddling down to the mailbox. We're finding ways that we can continue to farm why can't some of this money be put into training instead of into wealth?
I have two questions too. One is on the health care thing, and it's about abortion. Phil Hare said that it didn't have to be in there, that there's nothing in there about abortion, that it didn't have to be because of the Hyde Amendment. But someone else also told me that if it doesn't say in the bill they will not spend the money on abortion, that they can always still do it. Is
Yeah,
that
they
true?
pay for an extra insurance policy.
Remember what I said, you gotta be careful what's not in there. And you know, here's the thing also that we need to remember is that if this thing is gonna be so good, or whatever they come out with, I think that every member of Congress and Senate ought to be on the phone.
My second question's on a different issue.
Okay?
That we should be able to drill for oil off our shores instead of off of Brazil and pay for that.
Yeah. Go do. Yeah. I'm with you on that. I do believe that what we need to do is quit paying money to people that want to kill us. We've got a lot of things here, right here in the United States. Plus, guess what? We employ people here in America. Amen to that.
We should keep the prisoners in Gitmo.
A question and then just a comment. The question is, even if we just have 10 million people who are Americans and they're working hard, they're making minimum wage, they have kids, and they can't afford health insurance. What are you going to do about those people when they have to decide whether they should pay for a health care or insurance, health insurance bill premium, or pay for food for the table? That's a question. The other thing, I just want to make a comment. I noticed that list over there, and I see fascism and socialism mixed up on the same sheet.
That's not mine.
I see, because it seems like people are demonizing each other. I think Democrats, Republicans, conservatives, liberals, we're all in the same boat. We have the same need. We have a boat that's pretty much shaky, and we should decide how to, there may be a hole in the bottom of the hull. We need to figure out how to fix it. And we should work together on it and not call each other names. And it seems like when we're demonizing people and we put labels on situations, we're automatically creating barriers to understanding. And I really feel like a lot of the questions asked here could be answered on their own if they read newspapers or they go online and instead of listening to pundits on the radio.
How about on TV?
And TV.
All right, how about NBC, ABC, CBS?
They're the same. They're all the same.
No, they're not.
Yeah, they are.
No, they're not.
Yes, sir.
When NBC TV is owned by a man who is on the board with presidential advisor, he's also been named to the Fed.
To the Fed.
The money deal with Ben Bernanke.
To the Fed.
And they've also got stimulus money. You tell me what goes on with the news that you watch on the network.
Well, the three major networks are all owned by conglomerates that are very close to the same.
The young fella here.